Hello students, we'll discuss a topic which is rather a spotter, quite visible and obvious, maybe familial, multiple. See that multiple nodules are there. If you examine this patient back, it will be there in the back, it will be there in the front, the thigh, hands, arms, everywhere it will be there. So multiple it is. So very typical it is multiple neurofibromatosis, also called as von Recklinghausen disease of multiple neurofibromatosis, because there is another von Recklinghausen disease, that is von Recklinghausen disease of hyperparathyroidism, otherwise fibrosa cystica, that is what called as multiple fibrous and cystic phases in the bone. That is von Recklinghausen disease of hyperparathyroidism. This is von Recklinghausen disease of multiple neurofibromatosis. It's usually autosomal dominant. It is commonly familial. Type 1, type 2 are there. What you see is a type 1. It is quite common. Commonly they are familial. It is related to the chromosome 17. There is MCQ question, remember, which chromosome? And protein is again neurofibromin. That is again MCQ question. Type 2 is different. It is mainly in the spinal and cranial. Acoustic neurofibromin, other it is called as. Chromosome here is 22, here it is 17, here it is 22. That point is very important, you have to remember. And protein is Merlin, again MCQ question. And what is important is small coffee-like colored spots, light spot, coffee colored spot it is called as, light spot, very typical of the multiple neurofibromatosis, otherwise von Recklinghausen disease. Commonly it is of familial type. How it is significant? More than 5 in number, and each is 1.5 centimeter or more. So dimension of each is important. How many numbers also important? So it's count. Especially it occurs in the back side, abdominal wall. So you have to expose properly and see patient. Okay. So that is important. Other types are nodular, plexiform, pachydermatosal, elephantiatic. Limb is very big. Look like elephantiasis or lymphedema, but actually it is a neurofibromatosis. Cutaneous type, all these things are different types of neurofibromatosis. Single nodular neurofibromatosis is also known to occur. Now mainly they will have pain, distressing, may enlarge enormously also. It may turn into neurofibrosarcoma. Remember, precursor benign tumor is less likely to turn into malignancy except neural tissue. Like lipoma, current concept is will not turn into liposarcoma. Liposarcoma per se begins as a malignancy. Whereas a neurofibroma can turn into neurofibrosarcoma or different types of neural tissue malignancies. This is exception. So neural tissue can turn into malignancy, benign tumor. Whereas if it is this neurofibroma arises from the all layers of the nerve, whereas sannoma or neural lemoma arising from the Schwann cells, only outer layer. So that's why it's very tender, freely mobile, but nerve will not be disturbed. Whereas when you excite the neurofibroma, function of the nerve may be lost. So that's a difficulty. So neurofibroma is more likely to turn into neurofibrosarcoma. Hemorrhage can occur, necrosis can occur, pain is common, it may compress also if it gets enlarged. Melanin transfer is also known to occur. One of many neurofibromas may be there, but few of them may turn into neurofibrosarcoma. There is a point which you have to remember, it may turn into soft tissue sarcoma, that is neurofibrosarcoma. So I already told differential lipoma, cystic swellings. These are the differential diagnosis which you have to remember. And all these things are the complications I already told. Spinal, cranial can cause neurological deficit, erosion. It can erode into the deeper bone, orbit, muscle, depending on the location. And the spinal canal, remember, very commonest spinal tumor is neurofibroma again. So it can partly inside the spinal canal, partly outside. They are called dumbbell tumor. So like this. So with the small neck in between. It may compress over the spinal canal, neurological deficit can occur. So you have to examine nerve roots, you have to examine the CNS also in many neurofibromas. If neurofibroma is there in the intestine, same multiple neurofibromatosis patients can have neurofibroma in the bowel also. So it may precipitate intussusception and cause obstruction also. The acute intestinal obstruction can be the presentation in such patient. So sarcomatous change, that's the most important thing. Mainly occurs in generalized type, von Recklinghausen is 10%, very sudden increase in the size and warmness, a dilated vein, soft, then erosion into the deeper plane, and eventually it spread to the blood, may cause secondaries in the lung and other areas, multiple secondaries in the lung, cannonball secondaries in the lungs, other areas can occur, blood spread. So that is also important thing, remember. So evaluation is clinical diagnosis, spotter I said. Suspected swelling, you should do the biopsy, incision biopsy or true cut biopsy. FNAC for sarcoma is not a good investigation. Then of course you have to do MRI in that area. You may have to do a PET CT to find out the spread. If size is bigger than 5 centimeter, stages become soft tissue sarcoma. Stages are different. GTNM classification you have to remember, which I have discussed. Soft tissue sarcoma I have discussed in earlier lectures. You can go through that lectures so that you can get it clear idea about the soft tissue sarcoma, GTNM classification, and accordingly you have to treat. And so treatment is simple neurofibroma, whatever causing problem. You can exercise under small local anesthesia. If it is bigger, spinal anesthesia in the lower limb, or elsewhere in the back or abdomen, you can use a general anesthesia as such. So excision is the treatment. It can be left alone if not symptomatic or not suspicious. Not suspicious malignancy is the point important. So clinical observation, clinical monitoring the patient is very, very crucial. If you need doubtful, you should exercise and send it for histology. That's the point which is very important. Neurofibroma is a commonly kept spotter, oxy, clinical case, a short case, short notes kept, and also many MCQs will come in this. I already discussed. And oxy they will keep, viva they will ask, and common entity rather. Very commonly we see, so this way you should know the details about the neurofibroma definition, because there are differential diagnoses for so many conditions like lipoma and so on. Neurolipoma mimics neurofibroma, remember. So there is way in detail about the neurofibroma. You can always go through my SRB's manual of surgery in a swelling chapter, detail with the lot of photos. It is there, that is sufficient. And how to examine swelling is there in my clinical method surgery current edition with video, how to examine swelling. So same way you have to examine swelling in these patients also. So always go through my methods, manual of surgery and clinical methods in surgery. Students, again I request you to subscribe my YouTube channel SRB Surgical Insight and update your surgical knowledge for daily X-rays, instruments, specimens, operative procedure, clinical cases, illustrations for 5 to 10 minutes. So also share with your friends and colleagues and press the bell. And please subscribe my YouTube channel for your better understanding and updating of your surgical knowledge. And also join live sessions for once in 2 weeks with the student presenting cases, hernia, long cases, short cases, mass abdomen, thyroid, breast, and so on, for 1.5 hours with the other professors in the line online with the live session, the interactive session in detail about the particular case. So it will be very useful when you present a long case in the exam. And also if you join live, you get a certificate which will be helpful for your future career also. So please subscribe my YouTube channel and view the lectures, it's important. And also join the live session whenever possible, tell your friends. So answer the MCQ. Familial type of neurofibroma may be associated with A, B, C, D. Find out the right answer. Acknowledge your answer. What this endoscopic condition is. See that this condition is here. Whitish patches A, B, C, D. Put the right answer in the comment box. I'll appreciate your answer. Again, the students request you to subscribe my YouTube channel and share with your friends and press the bell so that you will increase your surgical knowledge as such. So quotation of the day is don't give up, you will get best things. Needs dedication and hard work. But for this needs dedication and hard work. Without these two things, you will not come up, you will not succeed in your future professional career and family also, whatever in your future as such. That's why it's very important. Don't give up. That's important. Students, and also go through my SRB's manual of surgery current edition for in detail subject matter with the MCQs online, and everything in oxy is covered from general surgery, endocrine, thyroid, breast, parathyroids, GI surgery, everything, liver, gallbladder, GI tract, stomach, hernia, urology, specialties, cardiothoracic, neurosurgery, basics, instruments, specimens, anesthesia, and briefly recent advances with a lot of illustrations, photos, quotations, and treatment strategy, management policy, principles with a lucid, understandable language. With the wherever oxy topics are there, also it is covered for both UGs and PGs. So make use of my SRB's manual of surgery for your better understanding of surgery knowledge as such. And also my SRB's clinical methods in surgery. It covers all clinical examinations, general surgery to hernia, thyroid, breast, varicose vein, vascular diseases, GI examination, abdomen, briefly orthopedic, and with the instruments, specimens, and briefly images as such. The video examination of each topic, each chapter, which will very, very useful for your clinical examination, and principles of examination with a lot of photos and brief differential diagnosis in tabular form. But it doesn't contain, because it is a clinical book, it doesn't contain any management policy. For management policy, you have to go through the SRB's manual of surgery. But clinical book, it is very, very useful. Everything in detail it is there. So please purchase my clinical book and manual of surgery to have a complete understanding of the surgery as such. And my operative surgery, current edition with the 2-volume extensive book, about 10,000 photos and illustrations, very, very useful for upcoming surgeons, surgical surgery PGs, and practicing surgeons, in detail, step by step, all procedures, even GI surgery, general surgeries, endocrine surgeries, everything, step by step, with a lot of photos and illustrations, with the instruments, energy sources, everything it is covered. It will be very useful for all surgeons who is practicing. Before surgery, they can go through the steps and do the procedure skillfully without much problem. So please go through my SRB's operative surgery atlas and guide, atlas actually, text and atlas, current edition, 2-volume book, very, very useful. Definitely you'll understand the technique, small procedure to big major procedures as such. My SRB's tissue approximation, again brief small atlas book, 100 pages, which shows how to approach sutures, different suturing techniques, different methods, different types of suturing, different skills of suturing, different suture materials, and skin suturing, deeper tissue suturing, bowel suturing, laparoscope suturing, with the principles and also with the video of suturing. How to do all suturings or videos are there, that also very, very useful for all students. So please go through that, my SRB's tissue approximation book also. So students, again I request to subscribe my YouTube channel to have a best surgical update as such, a daily, day-to-day basis for your clinical knowledge, image-wise, and also join live sessions once in 2 weeks for extensive knowledge about the clinical discussions for more than 1.5 hours. So again request, please subscribe my YouTube channel, share with your friends and colleagues, and press the bell. So friends, I hope you have understood this lecture very well. Thank you so much.